Hello, my name is Robin. I worked in the dental field for 26 plus years as a treatment coordinator, teaching patients about their dental needs and healthful options. In this course, we will be going over different areas that may be concerning to your overall health. Oral healthcare needs like cleanings, x-rays, proper bite, and dental restorations. One very important key to your overall well-being is your dental status. The condition of your teeth and gums can impact just about every system in your body, including circulatory, digestive, reproductive, and your respiratory system. Due to the heavy load of toxins in dental offices, I highly recommend switching to a holistic dentist. Choosing the right dentist for yourself and your family is no less important than choosing the right doctor. Holistic dentists don't use amalgam fillings. They don't offer fluoride treatments. They avoid crowns that contain toxic materials. They don't use products with BPA. They take x-rays sparingly, and they look at your dental needs as a whole health. Types of dental cleanings and when you need them. Prophylaxis, also known as a regular dental cleaning. A prophylaxis, or routine cleaning as it is commonly called, is a cleaning done to prevent dental problems such as gum disease or bone loss. Dentists recommend that patients do this cleaning every 6 months in addition to keeping up with their personal oral hygiene to maintain a healthy mouth. Here are some quick facts about routine cleaning. Performed on healthy mouth, free of gum disease or bone loss. Removes plaque, the sticky film that always forming on your teeth. Removes calculus, plaque that has hardened. Removes stain that are on the teeth. Debridement. It's important to know that this is not a cleaning. It's a procedure that removes heavy buildup of plaque and tartar so that a dentist can accurately assess the condition of your gums, bone, and teeth. So you need a dental debridement if you have not had your teeth cleaned by a dentist in over a year. You have thick buildup of plaque and tartar on your teeth. The buildup is not just above your gum line, but has gotten below your gum line. Periodontal scaling and root planing, also known as a deep cleaning. Periodontal scaling and root planing, otherwise called a deep cleaning, is a non-surgical cleaning done to treat gum tissue before it gets out of hand. The root cause of gum disease is plaque. If left untreated, plaque hardens into calculus or tartar, which is bad news for your teeth and gums. Some warning signs that you may need this cleaning include your gums bleed when you floss or brush your teeth, red puffy gums. Tartar has created little pockets between your teeth and gums that house dangerous bacteria. Your gums are beginning to pull away from your teeth. Your teeth are becoming loose or falling out. You may be struggling with bad breath despite your best efforts. Periodontal maintenance therapy. It's a follow-up cleaning that helps to keep gum disease away. Other things to keep in mind about a periodontal maintenance are: it helps disrupt the growth of the bacteria that causes gum disease. Suggested for people who have had scaling and root planing or gum surgery. Recommended every 3 to 4 months. Healthy versus unhealthy gums and bone tissue. As the hard debris and bacteria builds up under gum tissue, it begins to eat away at healthy bone tissue, causing teeth to wiggle and fall out. This leads to poor chewing and digestion. Did you know caring for your teeth and gums reduces your risk for heart disease, stroke, diabetes, Alzheimer's, lung infections, kidney problems, infertility, preterm birth, erectile dysfunction, and even cancer? X-ray precautions. How safe, or rather unsafe, are dental X-rays? The dose of radiation is measured in millirems, also known as MREM. According to the American Nuclear Society, this is how much radiation you can expect from common activities. 620 millirems a year is the average level of radiation per person in the USA. 50,000 millirems per year is the safe allowable dose for people that are exposed to radiation in their workplace. You acquire 1 millirem from 2 hours in a jet plane, 7 millirems a year from living in a brick house, 10 millirems a year from cooking with natural gas, 2 millirems a year from sleeping next to someone else, 36 millirems a year from smoking 1 pack of cigarettes a day, 42 millirems from breast mammogram per breast, 63 millirems a year from living in the Colorado Plateau area, 700 millirems from an abdominal X-ray, 0.5 millirems from one conventional dental X-ray, 0.05 to 0.1 millirems from one digital dental X-ray. I'm with Dr. Mokola on how often and what type of equipment used. My personal recommendation is to find a dentist that uses digital X-ray equipment that does not use film, but a sensor to capture the image. This type of equipment typically generates 90% less radiation, is far safer. If you are prone to decay and oral health issues, you may need to take an X-ray here and there to see what's going on. If your oral health is good, push off X-rays 3 to 5 years. Always use protective shields, especially the thyroid collar. Health benefits of having straight teeth. Most imperfect alignment of the teeth can be treated. It is easier to keep straight teeth clean. Straight teeth are easier to brush and floss than crooked and overlapping teeth, which are more likely to trap food and particles. If teeth are crooked, there are places the bristles of the toothbrush cannot reach and plaque and tartar accumulates. Lowers disease risk. Oral bacteria from plaque buildup on crowded and crooked teeth can enter your bloodstream and affect the inner lining of blood vessels and brain. The same species of bacteria that causes periodontitis is also found in artery clogging plaque. Fewer headaches and less chipping. Alignment issues contribute to bad bites and teeth grinding, both of which can lead to headaches. Correcting alignment will help alleviate these issues, although more severe temporomandibular disorders, TMD, cannot be treated by orthodontics alone. The more your teeth jut, the more likely they could get cracked or chipped in an injury. In aligned teeth, the pressure from the bite will go along with the long axis of the teeth versus hitting from the side. This makes it less likely for the teeth to be chipped or braided. Offers better digestion. Poorly aligned teeth can compromise chewing, and chewing is the first step of proper digestion. When you chew, saliva carries enzymes that help break down the food, making it easier for the stomach and intestines to do their jobs and reduce the number of bacteria needed to help break down nutrients in the gut. So when chewing is a chore, people are often tempted to gloss over this important and pleasurable part of their meals. Smiling more and feeling happier. Research shows that smiling, even if it's forced, actually makes you happier. If you are self-conscious about crooked teeth, you might not be smiling as much as you would otherwise. A lot of people suffer from loss of self-esteem due to crooked or otherwise misaligned teeth, and then get confidence boost when their teeth are aligned. Smiling sends positive chemicals through the body and lowers acidity. 2 ways to straighten your teeth. Braces. These are bands and brackets that are bonded or cemented to the teeth with wires and elastics that force movement of your teeth into alignment. Better choice if you're not a compliant person. Teeth aligning trays. Clear removable trays that are changed out monthly for a new tray that forces the movement of your teeth into alignment. Great choice if you are a compliant person. Always request that appliances be made or cemented with BPA-free materials. The cost and time of either is about the same. Restorative dental needs. What kinds and what you really need. Sealants. White filling materials in a flowable form used to fill the decay-susceptible grooves of the back teeth. Usually utilized in children between 6 to 18 years as a preventive measure. Fillings. Amalgam are silver fillings made of metal alloys and mercury. A solid restoration, but very toxic when being placed and as it breaks down. Composite or white fillings, a less solid restoration, non-toxic if it's BPA-free. Placed directly into the prepared tooth. Used where the existing fillings or areas of decay are small enough that the remaining tooth structure has not been overly compromised. Be sure materials used for sealants and fillings are BPA-free. Inlays. Used in similar situations as fillings, except a pre-made piece of ceramic material is bonded into the tooth. This results in superior physical properties, possibly providing a lifespan to 2-3 times longer than a composite filling. Inlays are a top quality alternative to the composite filling. Onlay. Used in situations where the tooth is fractured or has been severely decayed. The onlay is similar to the inlay described above, except that the ceramic covers the entire or most of the biting surface. An onlay is more conservative in preparing than a crown. It does not cover the entire visible tooth structure, so there is no need to grind away all sides of the tooth unless there's a specific reason. A crown, the largest single tooth restoration, sometimes cannot be avoided. It covers all sides of the tooth as well as the end. It is used when there is limited tooth structure left, when an existing crown must be replaced, or when the tooth is an anchor tooth for a fixed bridge. Veneer. Thin porcelain facings that cover the front side of teeth. Used cosmetically to change the length, color, and shape of teeth. Can be performed with minimal tooth preparation and an excellent choice for a cosmetic makeover. Bridge. Used to replace missing teeth when sufficient anchor teeth are available on each side of the gap. Numerous systems are available, including fiber reinforced ceramics, zirconium-based ceramics, and porcelain fused to metal bridges. Inlays, onlays, crowns, and bridges can be made using metal, ceramic, stainless steel, all resin, and porcelain fused to metal. Be sure materials used to make temporaries for inlays, onlays, crowns, and bridges are BPA-free. Also, be sure materials used to cement inlays, onlays, crowns, and bridges are BPA-free. Implants. Titanium posts surgically placed into the jawbone. After placement, the bone grows around the implant through a process called osseointegration, usually 3 to 6 months after placement, and later the restorative phase can begin. Implants are used to support various dental prostheses ranging from single crowns to a full denture. Given the choice between a bridge and an implant is considered the superior choice since it doesn't require preparation of adjacent teeth and therefore more conservative. Multiple implants for full permanent bridge, or implants for removable denture. Though it is worth it, dental work that includes implants can take several months to complete and be expensive. Your dentist will have you wear very nice and comfortable temporaries as you go through the steps needed to complete your treatment plan. Removable partial denture, used to replace missing teeth when insufficient teeth remain to support a fixed bridge or a patient that is not a good candidate for dental implants. Partial dentures can be metal or acrylic based. This usually takes about 3 to 5 visits to complete this treatment plan. Removable complete denture, utilized when there are no teeth remaining and implants are not an option due to case specifics. By today's standards, this is basically a last resort. This usually takes about 3 to 5 visits to complete this treatment plan. The sure materials used are BPA-free. Partials and dentures are less expensive than implants and take usually a few weeks to complete while you wear nice, comfortable temporaries. You need to decide which treatment plans work best for you. Again, your oral health is just one part of many systems of your body that needs to be assessed when considering your overall well-being. There are 11 major organ systems in the human body. The 911 Health Fitness Makeover course will assist you in cleansing and resetting your body cells, tissues, and other 10 organs metabolically and give you simple ease to enjoy yet maintain well-being. I hope this was helpful, and I'm here to answer any questions.